So, Dr. Kralik, on May 25th, it was announced that Diana Taurasi would miss at least 4 weeks due to a small sternum fracture. Now, this is an injury commonly seen in motor vehicle accidents. How does this injury occur in athletes?
The sternum is three different bones. The top one is the manubrium, then the sternum per se, and then the xiphoid process. I also didn't see the determination of exactly where this fracture was in
Mhm.
her sternum, whether it was just a xiphoid fracture or sternal fracture, whether it was displaced. The fact that it showed up on a CT later probably means what they picked up is just some of the reaction to the fracture.
Mhm.
In other words, some of the new inflammatory area or the new bone formation around the site of the fracture. It sounds like it wasn't displaced, so
Yeah.
it could be a hairline fracture. Like you said, we see this mostly in auto accidents, but there are occasions, endeavors like bull riding
Mhm.
or other sports or falls from a height. Where it is exactly in the bone will help us determine what we should be concerned about. If it's lower in the bone and you have a direct blow to the chest, you really should be concerned about a cardiac contusion. Because if you can break that bone on your chest, you can probably bruise the muscle, which is your heart. And anytime you have a bruise or an injury to your heart, you have to worry about abnormal heart rhythm, and that could
Okay.
potentially cause death. The thing, what I always take from sternal injuries is watch and look for the associated injuries,
Okay.
and not only in the chest can you get cardiac contusion, but a lot of times what happens is when you have a blow to the chest and you get a sternal fracture, you could also have a number of rib fractures and have a pulmonary contusion, and
Mhm.
that can mimic a pneumonia and cause you to have respiratory failure and sometimes even be intubated.
Diana Taurasi suffered it, but then she played 2 games. Is this an injury that you could technically play through?
These professional athletes that play at such a high level have ignored pain and minor injuries all their life. The issues with sternal fractures, it will cause pain with certain types of motion. And I imagine if you look at her game tapes from the 2 games that she played when she had the sternal fracture, you'll see that she was trying to avoid certain types of motion, whatever that might be. Usually it's torque, raising one arm while lowering
Mhm.
the other. So,
And what are some symptoms that could signify that an athlete does have this injury?
but mostly it's just pain on inspiration, and then with sternal fracture, pain with certain types of motion, especially like we were talking about, where you're raising one arm and lowering the other. That tries to move
Mhm.
one set of ribs up, one set of ribs below, and then puts that pressure on the middle of the chest.
Okay. Now you said that sternum fractures can take anywhere from 4 to 6 weeks, and they said that Tarasi's fracture could be at least 4 weeks. Given it is a small fracture, do you think that it might be closer to the 4 week mark for her?
I don't know, because when she goes back, she's expected to work at such a high level. We send our patients back after chest surgery, to work in the office, and that's not what she's going back to do. She's
Hmm.
going back to compete with other world class athletes in a game where she could potentially get injured again. I'm not qualified to be the team physician, but if I were the team physician, I would put it out even longer than that, because I would be afraid of a second injury or another.
What could a second injury do?
If you're not 100% when you return and you're playing basketball and you're splinting or you're not moving in the right way, and you've got people around you pushing you and hitting you, you can injure yourself elsewhere. If you got one injury and you're not 100%, and you're going back into that environment, you got to be really careful. I mean, but that is my personal opinion, and that's
Hmm.
not a medical opinion. I'm just saying, she's got to be careful when she goes back. I suspect when they saw this fracture and picked it up, then they just went to the books and said, 4 weeks is when you
Hmm.
heal a fracture. It should be okay. She does have one advantage. The sternum is a very vascular bone, so it heals pretty fast,
Okay.
and you form new bone really quickly in your sternum when you get an injury. Because it's so vascular, because it's so productive, because it's the seat of so much blood cell formation, through
Hmm.
much of our life. So it could be something that heals quickly, and it may be something that they'll image again before they send her back. And I suspect they have got another set of imaging scheduled for her, 4 weeks after the fracture, which would be coming up, in mid-June, to see
Hmm. Okay.
when they're going to allow her to go back.
Now, with good healing, I'm sure there comes with complications as well for some people. What are some complications that this injury could present with?
The main issue that you're worried about is the injury to the other organs, the heart and the lung. I doubt, playing basketball, that you could get a significant cardiac contusion or a pulmonary contusion, but it is something that you always have to think about. And then the things that would result from those. But if you're just talking about bony fractures and the complications, they're pretty minimal.
Okay. But with any fracture, rest is obviously important. But the chest injury seemed a little tricky because if an athlete suffers, say, a broken bone in their leg, they can still exercise using their arms, things like that. But with the chest, that affects organs, like you mentioned, that assist with breathing. How can an athlete dance
Mm.
that fine line and still stay in somewhat decent shape?
She can at least, walk and maintain a certain level of fitness. But like you said, it will prevent her from being in the tip-top shape that she probably is during her season. Just because she can't do intensive aerobic exercise for a while. You're right. It's going to affect her level of fitness.
When it's time for Taurasi to return back, what should an athlete's progression be like, and how can they know if they're overdoing it?
The nice thing about basketball is that there's a clock, and they follow their time on court very closely. They'll put her in for 30 seconds, or a minute or 2 minutes, and then just see how she feels. Take her out and see how she feels. And I'm sure that will go on, when she plays the first game again. They'll put her in for a very short period of time, and then just see how she feels. They might even take her heart rate, or put a pulse ox on her and see how she's doing.
And lastly, do you see this injury affecting her in the long run if she is to heal fully?
No, I don't think it will. I mean, she's older, so she's young, but she's older as professional women basketball players are concerned. And generally, the older you are, the longer it takes for you to recover.